So today today we are going to learn scalp. Scalp. The mnemonics is scalp only. S for skin. The skin means subcutaneous layer. Here the skin gives septa, and this septa contains numerous blood vessels. And hair follicles skin contains. So skin contains hair follicles, sebaceous gland and sweat gland, and subcutaneous layer is a vascular layer, is a more vascular which contains many blood vessels. So we cannot place a tissue expander here. And in skin there is sebaceous gland more, so any inflammation of the sebaceous gland causes sebaceous cyst. Then A is aponeurotic layer. It is aponeurosis between the occipital belly and frontal belly of the occipitofrontalis muscle, the aponeurotic layer. So any damage to frontal belly, it cause to prevent formation of the wrinkles on the forehead, and also moving the upper eyelid to the upwards. Then L and these three layers are called surgical layer of scalp. L for loose areolar tissue. Loose areolar tissue is called dangerous layer of scalp. And also loose areolar tissue present between the aponeurotic layer and pericranium layer. So aponeurotic layer easily movable on the pericranium layer. In that point we can tell that tissue expander which can proliferate the growth of the dead cell is situated, we cannot place here in the subcutaneous layer because there is more blood cell, but in other places we place the tissue expander in the subcutaneous layer. Here we place the tissue expander in the aponeurotic layer. Then L for loose areolar tissue. What is loose areolar tissue? Loose areolar tissue, why is dangerous layer called? Here emissary vein is present. What is emissary vein? Emissary vein is a thin-walled venous channel which connects the external venous vein with the internal venous plexus. Like parietal emissary vein, mastoid emissary vein, and emissary vein passing through foramen ovale, and some emissary vein passing through the foramen lacerum which connects the cavernous sinus and pterygoid venous plexus, and also some emissary vein passing through the posterior condylar canal which connects the suboccipital and sigmoidal vein, and also ophthalmic vein we also is a emissary vein. Emissary vein balance the intracranial pressure of the both side because the blood flow on the both side and also any inflammation of the outer any infection of the outer skin can goes through the emissary vein to the cranium, so it is a dangerous layer called. Also any blood injury any bleeding in the loose areolar tissue comes to the eye, upper eyelid and septum of the nose because there is in the frontalis muscle has no bony origin, so it can easily come and form a black ring around the eye. It is called black eye. But for this there is no compression on the brain, so the loose areolar tissue is called septal layer. And after that there is pericranium layer which is adherent to the sutures and bone. Any collection of the fluid under the pericranium layer, it is called cephalohematoma. This is called fracture of bones, and this is the meningeal layer, and this is venous plexus, and from this the emissary vein goes. This is about the scalp mainly, and also I tell about the emissary vein in this video lecture. Thank you.